outside the sink. He's washed his utility gloves, dried them, put the disinfectant on them, placed them underneath the sink. He's taken off the overgloves, washed his hands, and that's where he is right now, ready to begin the patient treatment supplies. We do not use the heavy-duty utility gloves on the patient treatment supplies because they have been cleaning surfaces on the floor and in the sink. We don't want any potential for cross-contamination. Remember, we're managing the risk to the environment. So now he's going to put on overgloves in order to obtain patient treatment gloves. We are a non-latex environment, so all of the gloves that you will find are nitrile gloves, and he's going to get out the size that he needs. He knows he needs a large pair of gloves. So with the overgloves on, he's reaching into the patient treatment glove boxes, and he's taking out a pair of patient treatment gloves. So overglove, goes in and takes out the glove. He takes off the overglove, puts on the patient treatment glove, puts the overglove back over it, and repeats it on the other hand. So can you see that? Overgloves to obtain the patient treatment gloves, put on the patient treatment gloves, put the overs back on over them. Now he's going to obtain 8 paper towels. 2 are going to go on top of the counter. 2 are going to go in the second drawer down, which is the 3rd drawer. And 2 are going to go in the bottom drawer. So 2 on the top, 2 in the 3rd drawer down, 2 in the bottom drawer, and he will put 1 on the utility box top and 1 in the bottom drawer on the opposite side of the unit. So 8 paper towels altogether. And then he's going to obtain a clean pair of overgloves and place those back on the other side of the unit in that 3rd drawer down on a single paper towel. So a clean pair of overgloves into the 3rd drawer down on a clean paper towel. Do you see that? Now he's ready to obtain his patient treatment supplies from either the dental materials lab or the private treatment room. So he's going to walk to wherever he's placed his patient treatment supplies, obtain them, and bring them to the unit. When he returns to the unit, where is he going to place them? On one of the paper towels. Okay? So he's going to find his kit and his clipboard, and he's going to return to the unit and place that down on one of the paper towels. The first thing he's going to begin to disinfect is the clipboard, because he can't disinfect the kit until the clipboard has been removed from the area. So he's going to take a gauze square, place some disinfectant on it, and wipe the clipboard from top to bottom, doing the front, the back, and the sides, and he will place it in the 3rd drawer down on the paper towel that does not have the overgloves on it. Then he'll begin wiping the top of the kit. So from top to bottom for the kit, for the sanitization wipe, he'll begin with the handle, the receptacle that it sits in. He'll wipe the top of the kit, always away from him, and then he'll wipe the sides of the kit, the front of the kit, and the back and the bottom of the kit, and the back of the kit. See how he's working from top to bottom. So top of the kit, including the handle and the receptacle, the sides, the front, the back, the bottom. And when he's done with the bottom, he's discarding the paper towel and the gauze square that he used and placing it on the other paper towel. For disinfection, he's going to obtain another gauze square, a clean one, moisten it with the disinfectant, and he's going to repeat the procedure, beginning with the top with the handle, the receptacle that it sits in, the top of the kit, the sides of the kit, the front and the back of the kit, always going from top to bottom, and then the bottom of the kit. He'll then place the kit back on the same paper towel that he obtained it for the disinfectant wipe, and he will discard the gauze and his overgloves. So at this point, he's removing the overgloves, he's going into the third drawer where he put the extra pair, and he's going to place the overgloves, the clean pair, on his hands, because he's going to open the kit now and begin working with the patient treatment supplies that come into contact with the patient. So a change of gauze and a change of overgloves at this point. He's going to open the kit, and he's going to begin to sanitize each supply individually, wiping it and placing it on top of the clipboard that we already placed in the drawer. So the things he needs to think about are the blood pressure cuff with a sphygmomanometer, which he's wiping. He's also going to then wipe the patient handheld mirror. The stethoscope, and he'll wipe that top to bottom. Okay, so stethoscope top to bottom, and again being placed on the same clipboard in the drawer. Operator safety glasses, if you don't have them on, will be washed. They could be used as patient safety goggles. The disclosing solution, again, top to bottom. Pens or pencils that he will be using. So you know you need to have a black pen in there, you know you need to have a blue pencil, a red pencil, a lead pencil, a green pencil. Sharpening oil will get wiped and be placed in there. The oral self-care bag that contains the brushing and flossing supplies. There's an extra floss dispenser in there that needs to be wiped. Bib clip needs to be wiped. So everything that's going to be utilized for patient treatment needs to be sanitized and removed from the kit and placed in the drawer. You want to make sure that you have all the supplies that you're going to need for your patient in order to best understand how long it's going to take you to wipe them. Once he's completed the wiping of everything for the sanitization wipe, he's going to close the kit. He's going to discard the gauze, and he's going to obtain a new gauze to disinfect the supplies. Okay, so all the supplies have now been disinfected. He's going to obtain a new gauze, and he's going to now go through that second wiping process. So the first process is sanitization, new gauze. Second process is disinfection. So he's now going to, everything that you just sanitized, he's going to pick up and wipe again for the disinfection sequence. And he's going to shift it from that original clipboard area to the next paper towel in the drawer, to the other paper towel in the drawer. So everything was wiped initially for sanitization. He obtained a new gauze square, and now he's going to wipe everything for disinfection. As he does that, he will organize his drawer space. Some things will remain in that drawer, and some things will go to the bottom drawer. So, and that depends on how he wants to organize his particular station. So wiping everything for the second time, and then he's going to organize the drawers so that he has more room to work in the third and the fifth drawer there. The last item that he's going to wipe is the clipboard, because everything is resting on the clipboard. Once he wipes the clipboard, he's going to discard the paper towel that it was sitting on, obtain a new paper towel, put it down, and put the clipboard back on it, so that he can then organize the supplies and close the drawers. See what he's doing now? He's going to take things and move them to either paper towel in that bottom drawer. That allows you to have more organized workspace, and you'll be able to close your drawers appropriately because they need to be closed during patient treatment. So he's organizing everything, moving things around. We have paper towels in there that you're going to place things on. The drawers have been sanitized and disinfected. The supplies have been sanitized and disinfected. They are ready to treat your patient. When he is through, he's going to close up the kit, the yellow kit, place it on the paper towel on top of the utility box. He's going to place the Birex at the sink. The gauze that is unused that he'll use for unit breakdown, he's going to come over to the opposite side bottom drawer where we place the paper towel, and he's going to put that gauze packet in there waiting for breakdown. The entire countertop has been cleaned off. There are no paper towels, there's no gauze, there's no disinfectant. And the last step, he's going to very carefully remove the barrier from the monitor, the plastic barrier from the computer monitor. He's then going to remove his patient treatments and overgloves and wash his hands 2 20-second consecutive wash rinses. So the patient treatment supplies have been introduced to the environment now. We have removed the barrier from the monitor because we now want to place a fresh barrier on that monitor in order to treat our patients most effectively. So now the 2 20-second consecutive wash rinse is being performed. He's going to place on new overgloves only, because he is now done working with any chemical substance. That is why he used the patient treatments and overs when he was preparing the patient treatment supplies. But now we're going to just place barriers, which are plastic. As Mark was looking at the light lens, the mirror face on the patient handheld mirror, and the rheostat face, the silver rheostat, if he had noticed that they were streaked with disinfectant or drying in droplets, he would have taken a sterile gauze square and either lightly dampened it with water or just wiped off the lens, the mirror face on both sides, and the rheostat. You can see the mirror face, the light rather, and the rheostat are perfectly fine. There is no streaking of Birex. If he finds as he places his sleeve, plastic sleeve over the mirror handle, that there are any droplets, he can wipe it at that point in time too. You don't want the patients to think that they are dirty because they have droplets all over them, when in fact they're really extraordinarily well disinfected. But a patient seeing that is questioning why that looks like that. So you would take a gauze square, a sterile gauze square, and just dry those off so that they were streak or droplet free. So now he's obtained overgloves, and he's going to place the barriers on the chair to help protect the high-touch areas that are more difficult to sanitize and disinfect. These are called chair protectors, and he's going to place one over the back of the patient chair itself, and he's going to start with the monitor. So a half chair protector is going over the monitor. See how he's peeling them apart at one end. One end is open, one end is closed. Another barrier over the back of the chair that protects the headrest and the back of the chair. A third barrier will go over the bracket tray. So it will go over the whole top of the tray and the cords and hoses that are associated with it. And he will also put a fourth barrier over the keyboard in the top drawer of the unit. Okay, so this one is going over the bracket tray, and the next one will be going over the keyboard that is in the top drawer of the unit. Okay, so right over the top of it, and he's going to just tuck it in around the sides. So place it over the top and just tuck it in around the sides. Then he's going to obtain the plastic sleeves that will, light cover handles. All right, so let's do light cover handles. So there's a box in there that are light cover handles. You will take them, there's a small opening in one portion of the handle, the cover, and you will place it over the front of the handle and then over the back of the handle and do the same on the opposite handle. So just tuck them right over the lights. And then plastic sleeves. And he's going to place plastic sleeves this semester for you. You're going to place over the air-water syringe and the slow and the high-speed evacuation hoses. So that's your air-water syringe, and he's going to open it up at one end and just let it drop or pull it into the plastic barrier. And it's easier to kind of let it drop in there because the gravity of the weight will assist you. He's going to come over to the high and the slow speed evacuation hoses, crinkle open the end that opens and place them right over and pull the hose into each one of those plastic sleeves. Those will protect the high and the slow speed evacuation. He will obtain another sleeve and place it over the handle of the patient handheld mirror. Again, if he notices that there is streaking or residual disinfectant, he'll wipe that off. Okay, so he'll obtain a patient handheld mirror and place it over the sleeve. The mirror face looks good, correct? So that will go right over the handle. Again, a high touch area. Patient is in constant contact with that. And so are you, handing it back and forth to the patient. Then he's going to obtain barrier wrap. When he uses the barrier wrap, if he needs to place it on a counter, he may only do so with a paper towel under it. When he uses it, he's going to cover the light switch. Notice how he's keeping the wrap out away from his lab coat. Your lab coats are contaminated. Over the arm release buttons, so there's one on the right side of the unit and one on the left side of the unit. Again, barrier wrap is out away from his coat, not around his wrist. Placing another one on the arm of the bracket tray. Another barrier over every paddle on every stool that you would utilize. And you're going to place them over the top and depress them underneath because you will be touching both the top and the bottom of the stool paddles. So the operator stool, and if there's another operator stool, you would do the two on the other side. If it's an assistant chair, there might only be one paddle. So whatever there are for paddles, you're covering. He's going to cover the buttons that you depress for drinking and for the cuspidor spigot, and far enough forward so that if water hits them, it will not go anywhere but onto the actual surface and not off the side of it. Over the porthole for the cuspidor. He's going to cover the soap dispenser top, both the dispenser at the sink that we do not utilize, the hand pump, and also the hand sanitizer. If you had an X-ray view box at your unit, which typically you will not anymore, but if you did, you must also cover the on-off switch on that as well. Over the top of the mouse that's in the drawer. Okay, so the barrier wrap will go right over the top of the mouse. Also, another high touch area. And then he's going to check around and make sure that he has covered everything sufficiently. He's checking, again, the light switch. He's checking the area where he's going to place the biohazard bag, the chair paddles, the porthole for the ultrasonics down here, the cuspidor buttons, the arm releases, all soap dispensers. There are 3 at this unit, and the mouse. If there were a view box, you would cover that. So the syringe covers, or the plastic sleeves over the evacuation hoses, the air water syringe, and the mirror handle, and your half chair protectors over the chair, the bracket tray, the monitor, and tucked around the keyboard. That's the only one that does not get opened up. It just lays flat over it. He's now obtaining a biohazardous waste bag, which is also known as a headrest cover. So the boxes that you obtain them from will say headrest covers. This is what we utilize as a biohazardous waste bag. And notice how he's adjusting that barrier wrap to hold that bag sufficiently so that when we do place biohazardous waste in it, it's not going to fall onto the patient or the floor.
What did you secure it with?
The barrier wrap, one of the plastic barrier wraps. He's then going to obtain the cassette for the patient, the instruments that we're going to work with, and he's going to do that from outside Central Supply. Remember, we talked about how you would obtain these from outside Central Supply, and I'm just going to open this door for a minute. When you look in here, all of this tape, all of this indicator tape, remember, should have changed color. So prior to taking it out, you want to make sure that what has been placed in here is sterile. Okay? So he brings that right over to the unit, places it at the unit, and now he's preparing the unit for patient treatment. So he's pushing the bracket tray back, he's pushing the light back, he's making sure that the stools are out of the patient's way. He'll release the arm release button so the patient can get into the chair comfortably, and be sure that the chair is not up so high or down so low that the patient cannot comfortably access it. He's checking the floor and the countertops to make sure that nothing has been dropped or discarded, that there is nothing in the way of the safe and effective entry of the patient. You saw there was a barrier wrap on the floor. He's picked that up with his overgloves on because he's now done utilizing them. He's taken them off, they've been discarded, and he's washing 2 20s at this point to then move further into obtaining his patient for treatment.